Hey, everybody, welcome to tonight's live. This is going to be crazy. So, please, 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 this is so important. You have to see this video. I'm going to make this very bold promise to you that if you don't learn two things tonight, if you don't learn something new that you've never heard before, and you don't learn something that will totally freak you out and scare you, then I will give you one of our free hormone test kits. So stay tuned and take some notes because I want to be held to the fire on that. And there's just so much you need to know. I get asked all the time about bioidentical hormones. So that is something we're going to cover tonight because there's so much misconception around it. And it's really important because they can be life-saving, life-changing. Women are suffering. So I'm going to go through what are bioidentical hormones, why they're important. Hi, Connie. Why they're important. And while you guys we're kind of waiting for things to fire up a little bit, tell me where you are at right now. What state you're in, or you can tell me what state you're from, but where you're at right now, so I can just kind of know where you guys are all at. When we fill our orders for test kits and our hormones in the office, I'm like, that's so crazy. People are like from all over the place. So that's exciting. Hey, Sandy, thank you. Okay, so we're going to talk about some of the hidden dangers of synthetic hormones. Georgia, Iowa, I love that. Pretty as they come. I guess Georgia girls are pretty as they come. And we're going to talk about routes of delivery, and we're going to talk about some scary, scary, scary industry secrets that they don't want you to know about. And I know that's sort of a bold claim, but this is stuff that you absolutely have to know about. And one of the reasons is because women are suffering, and they will go find, if you're suffering enough, and you will just go through doctor after doctor and begging people to test your hormones, or when you finally get someone to put you on HRT, it's very important that you know what is safe and what is not, because it could actually hurt you. So some of that stuff they say about hormones cause cancer, it's very true unless it's done the right way. So I want to make sure you have all of the facts, and I want to make sure that you get an idea of what we are up against. And I don't want you to just go blindly into hormone therapy. This also applies to perimenopause. This also applies to anyone younger having hormone imbalances. Super, super important as well. And my moderator / fiance is saying, if you would tap the screen and show some hearts, that also sends to other people. So while we're kind of gearing up to get started, kind of the introduction here, there's a little arrow there that's a share button. And if you know someone who could benefit from this, please share this. And I always replay the lives, so or post the lives. So if you miss something or you're trying to take notes and don't get it, just let me know, and I can make sure that you get the information. I'm also here every night at 7 o'clock, and I love you guys so much, and I'll just keep showing up as long as you guys do, and as long as this information is good. So, okay, I'm going to jump right into this. And so I have to start every conversation about what are hormones and why are they important, and what our life cycle looks like as females with hormones. Hormones drive every single process in our body. So when we say hormones, we have to be very clear about what hormones. And you don't have to have a medical degree to understand that hormones are super important, and that when we have imbalances, it regulates our metabolism, our sleep, our ability to fight off cancer, our ability to regulate our cholesterol, our heart, our brain, everything. So hormones are just messengers. There are many different types of hormones. So I hear people say all the time, I have a risk factor for, or I have had breast cancer or uterine cancer, and they tell me I can't take hormones. So we have to be very, very clear what hormones we're talking about, because thyroid is a hormone, estrogen is a hormone, progesterone, testosterone, insulin is a hormone, GLPs are hormones. So there's so many different hormones in the body. But what comes up is when we're talking about menopause. So that's going to be my main focus tonight. What comes up after menopause is that everyone immediately goes to estrogen. And I always say that if you didn't have a thyroid, they would never tell you that you don't need testing or that you don't need thyroid hormone, right? Menopause is just by definition a year without periods. It means absolutely nothing. It's kind of like having a hysterectomy and having your uterus removed. That means nothing. The hormone imbalance is what is relevant, right? And so if we want to either fix a hormone imbalance to prevent a hysterectomy, or we want to take a woman who's not had a period for a year, aka menopause, and address the ovarian failure, then that's what we're talking about tonight. And what is the safest way to do that? And what do you need to know? Okay, so let's start with a little graph. I love the nerdy little drawings. So, and I know these are really busy and it's kind of hard to see everything. This is more for my organization to take everything that's crazy in my brain and kind of put it into one place. But so don't worry about what you can see or can't see or read, because I just want to kind of share the overall information. Okay, you know me. If you know me, hi, Constantina. If you know me, I love to draw a graph. So we're going to start right here. So this graph is estrogen and progesterone is on this axis, and this is time. So this is from birth to 100. And I have childhood, puberty, reproductive years, perimenopause, and menopause. And again, menopause is just 1 year without a period. Hi, polyester. I love that. It's cute. Okay, so in childhood, there's not much going on for estrogen and progesterone. Actually, baby girls are getting some estrogen influence from their mothers, and a baby girl will actually sometimes get a little bit of breast buds and may even have some vaginal spotting. So a little bit of estrogen comes from mom, but for the most part in childhood, you don't have much. Puberty kicks in and it is really irregular. And that's why we kind of lose our ever-loving minds in puberty. And I don't know if you've ever seen the movie, what is it? Inside Out, is that what it is? So like the latest one is like the little girl goes through puberty and like everything changes and she's just, psychotic almost. So puberty, our reproductive years, our estrogen, progesterone's doing all this. And then in perimenopause, things go really crazy, even more so than puberty. And yet we think we have the faculties to kind of regulate that, right? More than when we didn't have the experience of being in puberty. So, but it's even crazier hormonally, how to lower estradiol. So we'll talk a little bit more, and Champion, come back to that if you still don't have a lot of clarity around what we're talking about with estrogen, progesterone. So hang on just a second. Okay, so this is menopause. It's just 1 year without a period. And then what happens is during perimenopause, progesterone, which is the green one, drops off first. So you stop sleeping, your mood's erratic, you're puffy, you're gaining weight. And then what happens is you completely flatline on your estrogen, progesterone, and testosterone. So why is that? I had a total hysterectomy and cannot take estrogen. So I'm going to tell you what the myth is about why you think you can't take estrogen. Swear by I'm 70. Yes. Okay. So hopefully by the time I get that all the time, I can't take estrogen. At least we've moved one step ahead and you didn't say I can't take hormones because, right, we established that thyroid, insulin, all the things are hormones, right? So we're clear about you're concerned about estrogen. So here's where we're going to go. So first of all, once you go a year without periods, all the eggs you're ever going to have are gone. Your basket is empty. We are designed to have just so many eggs. And during puberty, we start these hormonal cascades that stimulate a hormone in the brain called FSH that then makes these follicles in the ovaries that then start stimulating egg maturity, basically. Okay, so once we start maturing our eggs, then when that happens, we start this whole hormonal cascade, and then we start building up a lining in our uterus. And then the brain says, oh, that's not so good. You don't need all that blood in your uterus right now. And then when ovulation happens, and I'm going to come to this picture just a little bit. This is hormones, and this is a 28-day cycle. And this is ovulation down here. And if ovulation happens and the egg is not fertilized, then progesterone kicks in and calms that down. So that is my case for during menstruating years to have progesterone and estrogen because they balance each other out. So that is very, very important. So no matter what, whether you have a uterus after a year without periods, that is what we call ovarian failure. And if you check an ultrasound up to a few years out from ovarian failure after you're not having periods anymore, the radiologist will actually read that as ovaries non-detectable because they literally shrivel up like raisins. You are in ovarian failure at that point, and this is hormone depletion syndrome. So you have no estrogen and no progesterone. Negligible amounts, I will say, because you still do have adrenal glands that sit on your kidneys, little glands that do make some of your estrogen, progesterone, testosterone. However, the adrenals are also responsible for making your cortisol, your adrenaline, the things that regulate your blood pressure, the things that regulate your blood sugar. So the adrenals really, that's a backup plan. They really don't make much. And if you check a woman's estrogen, progesterone, testosterone after she hasn't had periods for a year and she's in ovarian failure, they're almost non-detectable. So, and if you want to order a test kit, we can prove that too. So I do have, while I'm talking about that, I do have a link in my bio, and it has how to order a home lab test kit. So you can check these things because a lot of people have a hard time getting their doctors to check their levels. And so we can see where you're at. And then we're going to talk about what the plan is. But I want to make sure you feel very comfortable with what follows after this. Okay. Yay, order my kit. Yay, done. I love that. Okay. So when we're dealing with this ovarian failure, we are also dealing with hormone depletion syndrome. So you are completely flatlined. Okay. And I'm going to talk about a study that was done, but what that study that was done is actually pretty scary. And it was done in 2002. But one of the things that they did in this study was they took women at about the age of 65, so they did not have the protective benefits of having estrogen, progesterone, testosterone. Connie says, do my saliva collection tomorrow. Yay, you wake up in the morning. I love it. Do it. Do it. We have some people order the kit and it's like weeks before they send it in. So you got that momentum, girl. You got to do it. Okay. So they didn't have the protective benefits, and the hormones that they used. If you watched my video a few nights ago, like my cliffhanger at the end was like, holy crap. I'm going to share that with you a little bit because I want you to understand, and we'll circle back to this at the end so that you can see exactly what I'm talking about, but so that you can understand what's going on here. Okay, now I'm moving around with my boards a little bit because I wanted to be a little prepared. But there was a study done in 2002, and they took women out 10 to 15 years from menopause. So they had no protective effects of ovarian hormones. And if you think about who gets cancers and heart disease and breast disease and all the things, it is not usually the women who have higher estrogen, progesterone, testosterone during their menstruating or fertile years. It is women my age, I'm 55 and older, who have all those risk factors, right? Because they don't have the protective effects of those hormones, because those hormones are life-giving and life-saving, right? They protect you, they keep your DNA intact, all the things. Okay, so this study was done in 2002. And what they did was they basically examined to see, the study was designed to see if estrogen would prevent heart disease. And the study showed that yes, it did. However, as they were going along in the study, they were using synthetic estrone, which is the problematic estrogen. I'm going to show you these metabolites and the breakdowns in just a minute. 35 in tumor was estrogen receptor. So I'm going to show you something about that that will blow your mind in just a second. And so the study that was done in 2002, as they were breaking down the data, someone decided, and you have to decide for yourself who that someone is, but I think you'll understand before this video is over who that someone is. Someone decided that they were going to take the data to the media, and they were going to falsely claim that 1 in 4 women on hormone therapy will get breast cancer. That's freaking terrifying. If I thought that was the case, if that was all estrogen, all hormones caused 1 in 4 women to have breast cancer, Holy crap. If I was on it, I would throw it in the toilet. I would not even take that chance. That said, in 2001, before 2002, when the study was done, this is percentages, this is 60%. 60% of women were on some form of hormone replacement therapy, or HRT. The study done in 2002, 2003, it dropped down to 30%. This is 30%, 30% right here, down to 30%. Now we are in 2024, almost 2025. The rate is less than 5% of women on HRT. And you ask any woman around you in menopause, which is just a year without periods, in ovarian failure, and someone said 34 ovarian failure happens all the time. And that's because lots of things. A big stressor can do that, but the hormones that are in our environment can do that as well. So, okay, so this is what we're dealing with. So if you ask women in ovarian failure if they're scared of hormones, everybody says that, right? And the doctors say it too, which is so infuriating because they're not sharing this data with you. And so they're just repeating a narrative, and it's gross, and it's hurting people, and it's killing people. So this, what you find out tonight, is so important. On HRT for a year was 0, feel bloated, now gaining weight. Okay, so if that's the case, if you're bloated and gaining weight, it is not the right dose for you. So I'll do tons of videos in the future. Oh, thank you, Nadia. I'll do tons of videos in the future. But I will just say that the balance between estrogen and progesterone, like the little graph I drew a minute ago, is so important, and every woman is different. So one size does not fit all. Okay, I'm going to get into that as well too. So this is what we're dealing with. Women are actually absolutely terrified. But one of the things that they did in this study was they were using a form of estrogen that is extremely problematic. So, okay, so here we are on the graph, and I'm doing live stream on my other computer here, so let me adjust that. And so here we are on this graph. So your body takes a hormone called cholesterol. Yes, cholesterol is a hormone. It is not a fatty globule ready to cause a heart attack. It is a hormone, and they don't want you to know that. They want you to think that if your cholesterol is a little bit high, they don't want you to know that's because your other hormones are imbalanced, and that you actually use your cholesterol to make hormones, and that your liver makes most of your cholesterol because it's a hormone. And yet there are, I'll just say, I'm just trying to plant this seed about this dangerous, insidious thing and who these people are. I want you to know about this stuff. So there are about 100 million prescriptions written a year for statins, for cholesterol medication to block your cholesterol. And there's a little over 300 million people in the US. So almost a third of people in the US are on a cholesterol blocking medication. And you'll see just a minute why that's so dangerous. Buy OT for a year and a half and have terrible acne and still sleep awful. Okay, so they have to be balanced. Estrogen, progesterone, testosterone have to be balanced. Pregnenolone, I saw someone mention pregnenolone, DHEA, all the hormones. So this is the pathway. Cholesterol makes progesterone, which there's a side pathway that makes cortisol. There's a side pathway that makes testosterone. There's a side pathway that makes DHEA. So there's a whole bunch of hormones in between here. But the thing that I want to point out is that estrogen is not estrogen. So when people say, I can't take estrogen, estrogen causes cancer, you have to say which estrogen. And so I can go head to head with anybody who wants to dispute this information. I am a medical doctor. I have almost 25 years experience, and I'm a total nerd with the science. I don't take anybody's word for anything. I read the science, and this is biology 101. I learned this in college, and I went to grad school and did hormones in grad school and public health in grad school. So I'm telling you, I studied this extensively, not only clinically, but research. So just Don't take anybody's word for this. Do your research, because I promise you, if you go back to just a simple biology book, you'll see this is true. Maybe not the first page on Google, but if you go back to your biology book, you'll see it's true. Okay, so cholesterol turns into progesterone, which is your main sleep hormone. And these two hormones, progesterone and estrogen, are very important to balance each other out, plus regulated between all the other hormones. Once you are here and you're an ovarian failure, your liver can make cholesterol as a prohormone and convert these hormones. So if you can give your body estrogen and progesterone and testosterone, your liver knows what to do with it. It can use cholesterol to make these other molecules. So it's very important that in ovarian failure that you have hormones, but you want to make sure it's the right hormones and the safe hormones. Okay, so the different kinds of estrogens are E1, E2, and E3. And if you're on bioidentical hormones now, you've probably seen on your prescription or on your bottle, E2, E3, P50, whatever it is, progesterone, testosterone, whatever you've got in your blend. And we're going to talk about the difference in compounding and commercial pharmacies, the difference in bioidenticals and synthetic, okay? So estrone is a estrogen. I always say God doesn't make a bad estrogen, but it's an estrogen that your body makes as a side metabolite that is what we call a proliferative estrogen. If you are a 9-year-old girl trying to grow breasts, then you want estrone. That's fine. And if you're a 9-year-old girl trying to grow breasts and you're overweight, you will store more estrone, which sets you up for a lifetime of potentially fibroids in the breast tumors. I mean, it starts as early as that. Now you take a 9-year-old girl who's got these hormone imbalances and you tell them that synthetic hormones will fix their problem. Well, yeah, it will shut down their ovarian function, put them in a menopause essentially. But what does that do? So I'm going to terrify you when I tell you about synthetic hormones. And I'm not just one of those doctors that are out there, flaky and like bioidenticals are the only way to go. This is absolutely terrifying. So, and it's going to be the difference between you understanding bioidenticals and understanding synthetic hormones. And once you understand what synthetic hormones are, you will not be scared of hormones anymore. I promise you, promise you, promise you. Okay. The body's balanced, then why is cortisol still high? Because all of those hormones have to balance each other. And birth control pills, yes, all of them are synthetic. Absolutely. I wish that they would use bioidentical, but they have to use high enough doses to shut down the ovary. So that's the point in birth control. Lowering your progesterone is usually, most people don't want to lower the progesterone. What you want to do is you want to bring the progesterone up to balance out. So lowering your progesterone is really not a good idea unless they're overdosing you with progesterone and using synthetic pills or something like that. So that balance is really important. Okay, so E1 is called estrone, and there are 3 main metabolites, meaning the breakdown products of estrone, and that is 2-hydroxyestrone, 16-alpha-hydroxyestrone, and 4-hydroxyestrone. So that is nerdy science, but you don't need to know that. But why am I telling you that? Because these metabolites, when they break down, can cause excessive stimulation. So excessive stimulation in the breast. And I had a woman one time who, my patients all know this stuff because I'm all about education. The word doctor in Latin means to teach. So my patients know this stuff, right? So she had been to a breast oncologist, meaning a breast cancer doctor, and went to med school just like me, did residency, but he did specifically his residency in breast cancer, okay? And my patient says she had a family history, so she goes and gets an MRI every year, and the doctor has to read it, right? Part of the insurance game, right? So the doctor visits with her and says, "You're on hormones?" He's looking at her paperwork, and she says, "Yes, it's okay. I'm on the protective estriol, E3. It's like, what are you talking about? Okay, so a breast oncologist who studies the science of cancer and chemotherapy and medications, who doesn't know the difference in the 3 main simple metabolites, E1, E2, and E3, that is absolutely terrifying. Okay, so And I know you guys are asking me about estrogen, progesterone, testosterone. I want to kind of get through this, and I think it'll answer a lot of your questions. So the last 15 minutes, I promise, if you haven't got your questions answered right now, I promise we'll come back around, okay? So I want to get everybody, and if I don't, then you can always DM me, and I respond to everybody's questions. So please do that too. Okay, and just a little plug. If you go to my link in bio, I have how you can order testing, how you can get on bioidenticals, and a ton of free information. So I have a ton of freebies. All of this information is in there that you can go read about it and get more information. And also, we have our shop store. So I have a lot of supplements and things like that. I'm all about supplements. So anyway, just some stuff you can look at. Okay. So we have E1, E2, and E3. So these metabolites of estrone also are stored in the fat. So when you are overweight, for every pant size you are overweight, you carry about 33% more estrone. And that's why your risk factor goes up of breast cancer. Whether you're on hormones or not, once you get out here, if you're overweight, you are storing estrone because it's a fat soluble estrogen. Unlike estriol, it's water soluble, so it just flushes through your body. But I always say estriol covers up E1 like a blanket and says chill out, like a fire blanket. And like, something's on fire. Literally, I can't say fire blanket enough because it's like that's what E3 does. And that's what's in bioidentical hormones like biased, compounded hormones. So I'm going to talk about what that is in just a minute. But every woman should know if she has a risk of breast cancer, what her E1 level is, what her estrone level is. And for that breast oncologist not to know that, that's terrifying to me, because if we could prevent estrone from going crazy out here because we're gaining weight from all the chemicals in our food, we could save lives. But do they want to save lives? That's the question, right? Okay, so, and you might be going, oh, but they're altruistic. I'll tell you, I've been in the medical world since I was a kid because I had sick parents. I've been in the medical world almost 55 years because my parents were really sick when I was a kid, in and out of hospitals all the time. I cannot tell you the corruption I've seen. I cannot tell you the horrible, horrible, horrible things I've seen. So if you are still like altruistic, thinking your medical doctor, and they're not all like this, right? A lot of medical doctors know this and do this. They don't teach us anything about menopause in med school, except for the fact that you don't have periods for a year and suck it up, buttercup, because estrogen causes cancer. That's what the narrative is. That's what they say. Okay, how do you lower cholesterol levels? Well, cholesterol is a side path, or cortisol is a side pathway. These are all what are called steroid hormones, and that's going to be important in just a minute too. This word sterol means steroid. That's what these hormones are. They are steroid hormones, okay? So if you want to lower cortisol, you have to get these balanced. And I just saw meditate. Yeah, there's so many natural ways and supplements and things that you can do to lower cortisol. But cortisol is a chemical. If you want to lower it, you don't always want to lower it because cortisol is your body's natural anti-inflammatory, like a cortisone shot. If you're inflamed or a sinus infection or you need a shoulder, which frozen shoulder is actually a symptom of menopause. So a lot of people don't know that. But if you get a steroid shot, that's what this word steroid is. So progesterone, estrogen, cortisol, that's what the word steroid comes from. So these steroid molecules, that's important that you understand that these are all connected. So if these are out of balance, your cortisol is going to be out of balance. You need cortisol to decrease inflammation. It's like a cortisone shot, right? That's what your adrenals do. That's what your ovaries do to make these steroid hormones. So if you're out of cortisol, you don't necessarily want to lower your cortisol because then you have adrenal fatigue and then you're going to have joint pain because you don't have your body's natural anti-inflammatory. It's kind of like, I always say it's God's aspirin to our body. If cortisol is too high, then you have extra storage belly fat. Now, if you have too much cortisol and you're storing extra fat because it's actually protective and it's inflammation, now you have more estrone, which is your problematic estrogen. And estrone also breaks down into metabolites that do cell signaling that can be a problem. My primary just put me on progesterone and bioidentical estrogen and testosterone. That's awesome. Yes, I love that, love that, love that. And if anything happens, if your primary is not educated in all of these things, then you can always find us too, and we'd be happy to help too, because sometimes if they don't know what they're doing, they won't always get the balance right, and you deserve to have the balance right. Okay, that all said. Okay, now here's the thing. E2 is the neutral one, and these have alpha and beta receptors. So in that study in 2002 that scared everybody, the study was originally just done to prove that estrogen reduced heart attacks, because the number one killer in women is heart disease. Okay, so they were seeing that women, once HRT came around, that women were actually having less heart attacks in before 2001, right? And like I said, they did prove that it did decrease heart attacks, because when they were giving women estradiol, they were giving them beta receptor, which decreases blood pressure and helps the heart function better. Now, the alpha receptors are a little closer to estrone. So there was a problem in the synthetic hormone that they were giving in that study. So they were coming out here at age 65 and beyond, so no protective benefit, and giving them estrone, which is a synthetic molecule. And I'm going to show you why a synthetic molecule of steroid hormones is so dangerous. Okay. So they were putting them on essentially cancer-causing estrogen. So I just want you to understand that if it comes into your mind anytime in the community when you're out there talking about what this crazy Dr. Tammy was talking about, when they say, I can't take estrogen or estrogens, or I can't take hormones, then say estrogen. And when they say estrogen, say, which estrogen? Estrone, synthetic estrone? You're right. Run for the hills. But the conversation gets much deeper. So you can tell them to come back and watch this if you want, or get my book. I also have a free copy of my ebook on the link in bio if you want to look at that too. PCOS absolutely can be cured. I do it all the time in my practice, and I will do that. I will post the replay of this. Absolutely. PCOS is polycystic ovarian syndrome, and that is basically an estrogen dominant syndrome. So estrogen and progesterone balance each other out. So if you don't have enough progesterone, PCOS is just progesterone deficiency syndrome. I mean, you don't even have to have, low progesterone. You don't even have to have cysts in your ovaries to actually have the definition of PCOS. And I have had every hormone problem you can name. So I've lived it. I've lived PCOS. I've lived endometriosis. And that's why I'm so passionate about this. And I saw the outcome of my mom not having hormones, because she was in that generation that they terrified her about hormones. And endometriosis, absolutely. Do it all the time. I use natural progesterone, piece of cake. But my mom was in that generation, and as the impact of that, she broke her hip, one hip twice, and broke her other hip, and had dementia, and she did not have any of these, and she had cancer. She did not have any of the protective effects, and she was still under that premise of being scared. My mom kept taking Premarin despite being told to stop. So Premarin is a synthetic hormone. That is what they put women on. They didn't use progesterone to balance it out, because they said if you don't have a uterus, I mean, there's just so much that study. We'll do a whole thing on that study some night to break that down. But yes, run for the hills. Premarin's bad. But I'm going to talk to you about bioidenticals and what your options are. If you have a family history, yes, you absolutely do need to be aware of this, whether you do anything with hormones or not. It's very, very important. Yeah, genetics, everything play into this, how your liver works, genetics, just it's all connected, right? Okay, so I'm going to keep going. So E3 is estriol. It's the protective one. Again, it's like a fire blanket. It goes over here on E1 and it says, calm down. So I have women all the time that are still concerned about using bioidenticals, that I can put them on E3, and it's very protective and life-saving. When I say protective, yeah. Highest when pregnant. Yeah, progesterone is absolutely, yes. High. Progesterone means progestation. Gestation means pregnancy. And that's why you sleep so good when you're pregnant, because your progesterone levels are through the roof, right? Okay, so I'm going to move on from this just a little bit. And I want to move into, because I promised that I would talk about the difference in bioidentical and synthetic hormones. So there's a couple of things that you need to understand about bioidentical and synthetic hormones, okay? So this gets confused a lot. Bioidentical and synthetic and compounded and commercial, okay? Because we've learned to associate bioidentical with compounded, but that's not necessarily true. Okay, I know that's a little confusing. I'm going to do that again. Could you be on E2 and E3? And I missed that. So bring that back around towards the end and I'll answer that. And I never use E1 ever. I use E2 and E3 biased. And some people, if you have concerns about breast cancer, family history, whatever your concerns are, go back and watch this replay because I think you'll feel differently. But I can put a woman on E3 with active breast cancer and know that I'm protecting her 100%. Okay. Okay, and then we also have to talk about route of delivery because that's very important. Okay, so again, I'm going to say this one more time. There's a difference between bioidentical and synthetic, and I'm going to absolutely terrify you when I tell you what synthetic hormones are. Okay, and there's a difference between compounded and commercial. So a compound pharmacy is someone as a pharmacy that basically takes your labs and the doctor's prescription and then the recommendations and looks at your symptoms. So one of the things we do is, and there's different forms, and that's kind of beyond the scope of what we'll talk about tonight, but there's saliva testing, there's blood testing, there's dried urine testing. And the reason I do mostly saliva is because we do topical bioidenticals because that is the absolutely best route of delivery. And I'll go head to head and argue with anybody about that. Do I use other forms? I absolutely do. But this saliva testing is probably one of the best routes to check bioidentical hormone creams. And I have my link in bio. So if you guys want more information or where we're located or how to let us help you, go to my link in bio. It'll go to a link tree and it'll tell you everything about where we are, what we do, and everything. Okay. So I love this because what this does is this is a symptom profile. And so everything that people don't even think about, like diabetes and fibrocystic breasts and acne and swelling and neuropathy and urinary incontinence, frozen shoulder, arthritis, hot flashes. I mean, it's like there's 70 things on here. So we take this and then we check your labs, and this is a saliva test. So you literally just spit in this tube. Yes, we are nationwide. We have our hormone experts. All my protocols that I have learned mostly through my own problems with endometriosis, PCOS, fertility concerns. I mean, just fibroids, everything. And then my patients over the years. I always believe that God does things for us and not to us. So I am here, a living, walking hormone mess. And through all that, I've helped my patients over the years. And I'm 55. I feel fabulous. I feel amazing. So yeah, so the saliva test is usually where we start because I like to let people see how messed up their hormones are first before we talk about getting on the bioidenticals. And God let me do you. Yay, Jane. I love that. Thank you. That makes my heart happy when my patients like go from the lights out to a disco show. I'm like, that's what lights me up. Right. So I love that. Love that. Somebody said frozen. I didn't see that question, but no, you don't need to freeze anything. It's stable and can go in the mail and everything. Oh, Tacoma, that's so sweet. Thank you. Thank you. Okay. So I'm going to get back to some nerdy science. Okay. So the difference in compounded and commercial is that we take your recommendations and we can specifically make combinations of the estrogen, progesterone, testosterone, DHEA, pregnenolone. We can even put vitamin D in there, which is actually a hormone too. Most people don't know that. And we can specifically dose it for you. And if you're not getting what you need, then we tweak it because everybody's different. And most of the time with the protocols that I've done over the years, we get it right the first time, most of the time. Okay, 80% of the time. But some people need to. And if your cortisol gets out of whack at some point, like some devastating event happens in your life, I hope it doesn't. But when the cortisol throws the other hormones off, then, we might have to readjust or something. Or ovarian failure, like somebody mentioned, they were in their 30s and went through ovarian failure. That was probably a massive cortisol dump and then something happened. I've seen, women who've gone through a death in the family or something like that. And like all of a sudden they're an ovarian failure. But 100% of women will go through ovarian failure. Again, menopause is just a year without periods. Our ovaries literally run out of eggs and they dry up and they blow away. So 100% of us, if we live past the age of 50, or some women do it 52, 53, if you live past the age of 50 and you haven't had your ovaries removed, then you're in trouble. Test every 6 months. About that, if you're not getting balanced and we need to check things, then we can do it sooner. But usually, if we test and we get it right and you're cruising along, I usually test once or twice a year. So I like to do that. Sometimes my hormones will be a little bit off and I'll be thinking, something's not quite right. I've been through a stressful situation. I better check. But usually it's not off that much, and just a little tweak here or there can make a huge difference. Okay, so bioidentical means that it is plant or animal based. Okay, so it comes straight from, where do they get it? They get it from yams, or they get it from different plant sources that have a steroid molecule in them. So plants actually make sterols or steroids, which is all of those: estrogen, progesterone, testosterone. There's still a bit of a chemical process to extract those molecules, those steroid molecules. And then once they extract them down so that they can make estrogen or make progesterone, but it is that organic molecule that they are just extracting out. And they, if you ever took any chemistry or organic chemistry, you know that there's different distillation processes. And oh my gosh, it might as well be magic fairy pixie dust, because at the time I hated organic chemistry and chemistry of all types. I was terrified of the little flame things. But like now it's so applicable. I want to go to med schools and teach them this stuff, because I didn't understand how applicable it was in real life. And it was just rote memorization. But this is so important that there are chemical processes. So when we take plant, and mostly plant and animal-based is more like thyroid hormones and things like that. But the bioidenticals come from plant. And there's also a question about Premarin, which was pregnant mare. And what they did was they did take horse urine and extracted it out. But the problem is, in the study in 2002, they made a synthetic version of it. They took that and copied it. And why did they copy it? I'm going to tell you in a few minutes. And that will absolutely freak you out too. Okay, so when we talk about, and I'm going to just kind of plant this seed for synthetic a minute before I scare you, but compounded and commercial. Okay, so when we're in bioidentical, most people associate these together. So this is individualized. And then the route of delivery matters, because if you put especially a synthetic hormone into the GI tract, it has to go through the liver to be converted, because that's where those hormones get converted. And then when that happens, the thyroid also converts through the liver. So if your thyroid gets thrown off, and most women who come into my practice in ovarian failure have their thyroid unbalanced. So all of that is just a hot mess in the liver. If you have fatty liver, if you have methylation issues, there's so many different things that can happen with liver conversion. So it is just best to go a topical route, or something that doesn't have to get swallowed. Okay, so creams, topical or vaginal. And topical creams, people are like, well, can I use vaginal? So here's something: if you're still scared of estrogen, which I hope that you're not after this talk, but you can use a vaginal estrogen. And because of the base that they put it in, it's a very thick base. It's all organic, but it's a very thick base, and it just gets absorbed locally to the vaginal tissues. So sometimes I'll use both topical and vaginal. Topical means arms, legs, belly, wherever you put it. And that is a thinner cream base that they put it in. So it gets absorbed into the bloodstream. So if you have vaginal dryness, or you're having issues with urinary incontinence, it can help with all those issues that you have in the urinary tract or the vaginal area. We have in our program, Hormone Bliss, hormonebliss.com. In our program, we do all of that. So, whatever you need, we do it, but we individualize, and our people work with you directly to figure out what you need. So about 30% of women do need vaginal estrogen, but usually if you do a topical bioidentical, which is, when I say that, it's like a blend of all the hormones that you need after we do testing. Okay, so troches are these little things that dissolve under the tongue, or what we call quick dissolve tabs. And so if it goes under the tongue, not going through the liver, yes, a small amount can get swallowed and go through the GI tract, but most of it goes into the small capillaries under the tongue. Then there are pellets, and I know a bunch of people have questions about pellets that'll pop up, and then some night I'll probably do all pellets. One of the problems with pellets is that it's really hard to regulate something that's in the body after it's in the body. So if you're going to put pellets, they look like little Tic Tacs, and we use a little trocar and we pop the little Tic Tacs in there, but that's in there for 3 months. And I have had to remove pellets that other doctors have done because they were really unbalanced, or they just blasted some woman with testosterone and she was losing her mind and about to go postal. So not a huge fan of pellets, but I just want to tell you that they can be compounded. So we can put estrogen, testosterone, whatever in a pellet. You can't put progesterone in a pellet because the molecule is too big. And so pellets are usually just testosterone and estrogen. You can do oral capsules, compounded. Again, that's the GI tract. Try to avoid that. You can also do gels or topical oils, sprays, and some compounding pharmacies do patches. Okay, so I want to talk about commercial pharmacies because there's a lot of confusion about bioidentical and synthetic. Commercial pharmacies would be a pharmacy like your big box chain pharmacies, and you can fill in the blank, any place that you do your retail shopping, a pharmacy there, right? So retail pharmacies actually do have bioidentical hormones, but the problem is, meaning plant or animal based, the problem is that they are one size fits all because they are in massive production, right? I'm going to tell you why synthetic works so well for massive production in just a minute. Okay, so they do pills or capsules, mostly. Some patches, right? So estradiol, I showed you E2 and E3. E2 is the estradiol that's very protective for the heart and brain and bones and all that stuff. And estriol is the protective that's the fire blanket over E1, right? So vaginal rings, injections, some commercial pharmacies have pellets, but it is one size fits all. So if I'm going to do estradiol for a woman in a patch, let's say, I can't put E3 in there because it's not compounded, so I don't have that balancing effect. And it's just estradiol tablets come in, if I wanted to do the GI tract, which I wouldn't, but they come in like 0.5 or 0.25 or 1 milligram or 2 milligrams, pills, patches, all that. So you can actually, and this question comes up, and I know you guys are going to blow up my chat with insurance. Commercial pharmacies do take insurance. Now, whether your insurance, because insurance companies are a scam to me if you want my actual opinion, whether your insurance covers certain things, then that's kind of up to you and your insurance company. But that is one benefit of commercial pharmacies. And that is one of the things that we consider is finances for people, right? FDA approved. That is a great question. Okay, so these commercial hormones are FDA approved. Now, whatever you want to believe about the FDA, right? I'm not even going to go there. But if you're going to go by something that's, quote, FDA approved, what does that mean? It means that it's tested. The only thing that has been tested for female steroid hormones is hot flashes. That is the only thing that they have actual FDA approval for. When you look at the symptoms of menopause, hot flashes is like 10 on the list. And if you have thyroid issues and you're cold all the time and then you're having hot flashes, temperature regulation has nothing to do with ovarian failure syndrome or hormone depletion. The number one symptom of menopause, I don't even say menopause, I say hormone ovarian failure. But the number one symptom that women experience once they've gone without without periods and they're in ovarian failure is fatigue. It's the number one thing, but there are no FDA approved studies for fatigue. That's off label. If a doctor gives you HRT of any form, and that's the difference. We say HRT if it's just what they're throwing at you. BHRT is bioidentical hormone therapy. So it's a little bit different terminology, but I still use it interchangeably sometimes. But one of the things that happens when doctors are considering FDA approval, if you look at that approval process, again, the studies are specifically for hot flashes only. And if that is like number 10 on the list of symptoms that women have, you're tired, you're not sleeping, you're grumpy, you're angry, your family hates you, your skin's wrinkling, you're peeing your pants, you're gaining weight. I mean, just all the things, those are off label. So to get a doctor to prescribe something to you off label, it's challenging because they don't have the data to back up their efforts. And if you want to talk CYA, cover your butt, right? They're not going to do that. So that's where a lot of the resistance comes in as well. So, okay. So one size fits all, but does it, right? And if you have a doctor who doesn't understand the importance of E1, E2, and E3 interactions and what's happening, and you don't have someone who understands that progesterone is important, yay, you got the kit. Yay, I love it. I'm excited for you. That's awesome. Okay. So now I'm going to do the really scary stuff because I know I'm down to almost the end of the hour because I have an hour with you guys. But I definitely, if I don't get to all your questions, I hope I'm answering a lot. But definitely go to my link in bio. There's tons of freebies, downloads, information. You cannot educate yourself enough about this. And if you are not even to perimenopause yet, start now because it's stuff you need to know. And I'm also going to talk about birth control or oral contraceptives. Can't even talk now. I'm just getting dry mouth. Hang on. I have to do my tea. Hang on just a second. I start sounding hoarse when I talk too long. Okay. So this is the scary thing that we're going to get into. So we have compounded commercial, bioidentical versus synthetic. Okay. And I'm going to have to get up and turn my thing around. Jane, yay. Okay. Send me a DM. Love it. Okay, yeah, if I don't get to answer your question, send me a DM. Absolutely. Okay, synthetic. Are you ready for the really scary stuff? There's an agenda here. Because why wouldn't they just use bioidentical? Why wouldn't they? Right? Is that the question? Synthetic are made out of something called petrochemicals. And if you look back at the history of medicine, Big Pharma bought out medicine in the inception of what we call the medical training system many, many years ago. And who did it? If I get cut off, whenever I get nixed, it's either because my phone went dead, but it's plugged in right now, or I'm saying something that they don't want me to say. So if you ever lose me, I apologize. And you might have to just like DM me or find me or whatever. Because this is stuff they don't want me to say. But okay, so the Rockefellers actually were the oil people, petrochemicals, oil. And the very first, you got it. Oops, be careful. Yeah. Because back then, medications were just used when you needed them, pain meds, or, if you had a cold or, whatever it was. But the first drug that they could get you to take every single day from petrochemicals that were byproducts of what they were producing was birth control. I'm not even kidding. Birth control. Because you have to take it every single day, right? Okay. And then they got into cholesterol meds and all the things and heart, and now we're falling apart. And so it's a mess. Okay. So crude oil and natural gas, petrochemicals. Okay, I'm going to turn this over. Hang on. I haven't figured out how to flip that board just yet. So, sorry. I didn't put my butt in the, in the viewer there just a minute. Okay, so synthetic. Why? Number one, because you can patent it. Do you know what a patent is? A patent is when you can claim that you own the rights to a product or a chemical. A patent. So every time that thing gets sold, you get money from it. Okay. So when we said FDA approved, bioidentical or natural hormones are not FDA approved because they're not just for hot flashes. But what I want to say is the actual chemical base are approved for many things. And the pharmacies that compound and make the hormones are FDA approved facilities because they make both synthetic and bioidentical. Usually in most, and a lot of pharmacies that are really passionate about bioidentical only don't, but some commercial pharmacies do actually make bioidentical. Remember, we said one size fits all, but they do make both. So these pharmacies are approved, right? But commercial pharmacies are using off label and doctors are using off label all the time. Okay. So these petrochemicals are crude oil and natural gas. And these are chemicals that make plastics, fabrics, paint, adhesives, gas, styrofoam. I mean, the stuff you put in your car to fuel your car. And we know that plastics have things called PCBs in them, which are actually called endocrine disruptors. So they disrupt your thyroid, your insulin, the GLPs, which we did a talk the other night. And I talked about like the setup we are for the weight loss shots because our endocrine system, our hormone system is shot. And so that's all we can do is take a shot to lose weight. So all these chemicals, and we know what these chemicals do. I mean, we know the Teflon, all the things. I mean, we know the class action lawsuits. We know all that stuff. I mean, there's no doubt that we have over 15 chemicals in our food supply that are not allowed in other countries. We know this. There's no doubt. I mean, it's like why we're not just in an uproar. Okay. So these chemicals can be refined. What does refined mean? That is called fractional distillation. So it's a process in the laboratory where they take these products, these petrochemicals like gas, diesel, kerosene, naphtha, any of those breakdown products, and they remove the impurities and they're left with methane, ethane, or propane. So those are gas byproducts, right? All from the petrochemicals. After they distill it, they do something called cracking. And cracking is where they take large molecules and they crack them into smaller molecules under heat and pressure. And this is when they make ethylene, propylene, and butadiene. And those are all carcinogenic chemicals. Okay. So then they do synthesis, which they make these little monomers, meaning one, chemicals that resemble steroid molecules, which steroids are, remember, cholesterol, sterol, that makes your estrogen, progesterone, testosterone, DHEA, pregnenolone, cortisol, all the things. And we know that those act like xenoestrogens, just like pesticides on our food. That's what these estrogens are. This is the chemical breakdown of estrone or E1, which is the chemical that they used in that study in 2002. They stuck women on unopposed, for the most part, estrone, synthetic estrone, and they got sick. Yes, and they shut the study down. So there are some accuracies in that study. They're reporting the absolute versus the statistics that they did were misrepresented. But if a woman is on synthetic oral estrogen, run for the hills. And you're right to be scared of that. Absolutely. If you have a family history or you've had breast cancer or ovarian cancer or anything, migraines, whatever, endometriosis, run for the hills. And this synthetic estrone is what's in birth control pills, high dose. And yet you tell a woman after menopause that she can't take any kind of hormones because they cause cancer, but you're putting a 9-year-old girl on synthetic estrone, a petrochemical, and that's okay. But we're suffering, and you won't give us bioidentical natural hormones because we've literally dried up generic estradiol patch. So any of the estradiols, they are bioidentical. You get them from commercial pharmacies usually. Sometimes the compounding pharmacies can do patches, but that's not as common. So it's transdermal route. So I'm a big fan of the creams just because the route of delivery and all the things just a lot safer. But I hope I have kind of planted this seed that the type and the route and the expertise and the understanding and someone who knows what they're doing. This is not something to take lightly because they're using synthetic chemicals that cause cancer. And they're doing it everywhere in our food supply and everywhere else. But I just want you to be informed and understand. Okay, so what can you do about it? So again, lots of E3. You need that fire blanket around E1 no matter what you do. If you just said, I just want some E3, I understand that, right? So, but E2 and E3 both have a protective benefit together. They're synergistic, they work together. So you want E2 and E3. You want progesterone to balance it out, just like a menstrual cycle. God didn't just give you estrogens, He gave you progesterone. And so the terms, too, I want to make sure I get this in, is that if you see ethinyl estradiol, that's a synthetic. That's just a little word for that molecule. That ethanol is that ethanol alcohol that's attached to that estradiol, right? That's how you know it's synthetic. And the progesterone is progestins, and progestins are very different from natural progesterone. And that progestins will actually abort a baby in your uterus, just to be blunt about that, because it changes the lining of the uterus, so an egg can't implant or a sperm can't implant. And it also, in high dose synthetic, tells the brain you don't have any hormones, you're done. Very, very different. So if you're wondering what you can do, it is my passion project to help every woman to understand these principles, whether we're the people or not, to help you, whether my protocols are the protocols for you. IUD, yeah, that's a bit of a different conversation, because most of the IUDs do secrete synthetic progestins. So it is just localized, but some of it can get other places. So anyway, I know I'm running over on my time, and I love you guys so much. I just, if I didn't get to your question, please DM me. I'm thrilled to answer your questions, and I can do that in a more extensive way as well. So our saliva kits are the estrogen, progesterone, testosterone that we start with, just to see your baseline. And then once you do that, all included, free shipping, everything, we ship it to you. We get on the phone with you and do a consult and talk about your levels and talk about how we can help you. And then the next step is to get you on bioidentical. We have different kinds, different blends, different amounts. Sometimes it's different. We do estrogen, progesterone separate. So it just depends on you, your labs, and your symptoms. But that is the plan. We also do supplements, coaching, whatever you want, but you got to get feeling better before you're starting to talk about diet and exercise and all that. So that is my main goal. And remember how I said we went from 60% to 30% down to 5%? My passion, my goal is, before I leave this physical realm, that I want 50% of women to know that this is safe and effective and life-saving, and it is a game changer. And if you are suffering, heck, if you're suffering, most women don't even care about this. Just give me some freaking hormones. I don't care what they are. I don't care if they're synthetic. I'm dying here. I'm shriveling up. I hate my family, or they hate me. So if you want something, you need that balance. Okay, so where can you get? We start with a kit. That just seems like the best route. And if you go to my link in bio, to order the test kit is there, and our information, our website. Go get a whole bunch of information. There's freebies you can download and all that. So yeah, but it's hormonebliss.com if you want to bypass my link in bio and the link tree, hormonebliss.com. And my moderator's been throwing that up in there a little bit. So my fiance, he's wonderful. But he's been throwing that up in there too. So it's hormonebliss.com. But yeah, let's take care of you. That is my passion project. All of my hormone experts that do your telehealth calls are all over this, and they are trained in my protocols. And we actually have a coaching hormone program that they go through, and we're working on making it available to the public to be hormone coaches too. So this is just, it's a beautiful thing when we can change lives and save lives too. So tell your friends, share. I'll get this reposted hopefully by tomorrow afternoon. So it's long, because these hours kind of take time to get. Oh, hang on. See, they're almost kicking me off. But it takes a little while to get these downloaded, because they're large. Hang on just a second. They're yelling at me. Okay. So they're saying my hour's up. But anyway, I love you guys so, so much. I need to move to no, you don't have to move to your area. This is all can be done on the computer, telehealth, on your phone, whatever you have. So yeah, go to hormonebliss.com or my link in bio, and it'll just take you there, and we can totally help you. So you don't have to beg a doctor to check your levels. You don't have to beg a doctor to give you bioidenticals, and we educate you on the difference. And yeah, we can do thyroid panels. We can do all that. So it just depends on what someone needs. Usually when you get on bioidenticals, it corrects everything because the thyroid and estrogen like compete through the liver. So usually you fix one thing. I get people off thyroid hormone all the time. So that is my goal because they'll tell you have to take thyroid the rest of your life. So I'm not telling you to stop any hormones or stop, thyroid, anything like that. I'm just telling you that there is a safe way to do this that again is life changing and life saving. So, okay. I love you all very much. And I'm here every night at 7:00 and I share all this nerdy information and I try to share new things that you've never heard before. And I like to freak you out a little bit with the truth. And I do have a YouTube channel too. It's Tammy Tucker, my YouTube channel, but I have a show called The Naked Doctor. It's a local TV show, but it's on all the large affiliates as well. And it's the naked truth about health, wellness, and lifestyle. So I am all about telling you the naked truth. So don't take anybody's word for it. Don't even take my word for it. Do your research. And I know this is complicated stuff, but when you hear something, I think God puts that on your heart, that discernment that says, this makes sense. Or I think I understand that. Tell me more, right? And you're not going to get that from the commercial medical community, right? Like commercial pharmacies. So thank you for keeping it real. I love it. I love to keep it real. And that is so, so important to me. Okay. Truly, truly, truly. I love you guys very much. And if you're free tomorrow night at 7:00, come see me. I love it. Ask your questions. DM me your questions if I didn't get to them. And hormonebliss.com or link in bio and get your kit and let's get you going because again, it's my passion to do this. Okay. Night, guys. $4,700.
That was a record. No, that was a record. No, there'll be more than that. No, there'll be more than that. I'm wasted. You fucking killed it. I mean, you could. It's nerdy science. I mean, here's the thing. You know what I thought about?
Oh shoot.
Oh, no, wait. Just wait. It's gonna be 1,000. There's gonna be 1,000 plus followers tonight. What you could do? You could.
Wait.